The second issue relates to the alcohol restrictions. I think here many people might have kind of been taken by surprise by this issue, but I think it's important also to say that there's been also many people who have welcomed and supported this issue of the suspension of the sale and distribution of alcohol. And when we look at this, at the end of the day, it's more about the limiting the damage that each particular set of circumstances tend to create. Now, we are very concerned about the fact that the consumption of alcohol in the country is pretty high. Well, it's estimated that 31% of South Africans 15 years and older are current drinkers, or they must have consumed alcohol in the past 12 months. This is a WHO Global Status Report which was done in 2018. Despite the low proportion of South African adults who drink, we're one of the countries that drink the most, and in the WHO Afro region at 64.6 grams of absolute alcohol per capita per day. That's about 5 and 6 standard drinks of 12 grams absolute alcohol. That's about 15 meals a day. Now this, it's important because it's higher. The average in the other countries is 40 grams per drinker per day. And so that's a matter of concern, that it's actually a matter of record. Almost 6 out of 10 drinkers over the age of 15 in South Africa are reported to engage in what is called binge drinking, that is high episodic drinking. In 2016, alcohol attributed trauma deaths exceeded deaths attributable to alcohol-related liver cirrhosis and alcohol-related cancers, respectively. So it's not only just the damage in terms of some of the related accidents, but also there are other conditions that are associated with alcohol in terms of the damage to various organs. We were moving around during the course of the week, and one of the professors from Steve Biko was indicating a very sad situation that alcohol-related trauma patients are usually young, fit individuals who would not otherwise have needed to be hospitalized. But because of the accidents, then they are there and they need to be given attention. During the level 4 and level 5 lockdown, a study done by Perry and others showed that there was a 60 to 70% reduction in trauma admissions because of that lockdown at that time. Conversely, when the alcohol restrictions were lifted during the level 3, facilities reported up to 60% of increase in trauma emergency center admissions and up to 200% increase in ICU on trauma admissions. So some of the modeling that was done to predict the impact of an alcohol ban, and these models was demonstrated that introduction of a suspension of alcohol sales could result in 20% reduction in all trauma and 40% reduction of all alcohol-related trauma by the 3rd week. So when we get into the surge and we require more of our wards to be available, it therefore means that the real problem, and many of us would have seen how in the media some of the staff or health workers have indicated the pressure that is caused by the admission of patients with trauma. The problem with those patients is that basically breaks the routine in the hospital management of patients. If somebody comes and is bleeding, you have to drop the person who's sick and go and deal with the one who's bleeding because it's an emergency. There are a number of instances where, in fact, you have to even stop theater and rush in someone who is having a trauma because of the nature of the bleeding, just to be able to save lives. In some instances, when you deal with, for example, someone who's got a stabbed heart, literally everything freezes and everybody will run into theatre even before they are fully scrapped, and that's the nature of the disruption that comes with the level of emergency that is created by the trauma. So these particular individuals will move from theatre to ICU and therefore demand attention from a large number of nurses and equipment. Now, we need those right now to deal with people who are coming with COVID-19. And therefore, to be able to create space for those individuals, we need to then make sure that we can limit the numbers of people who are coming in because of the trauma. I've even seen on, excuse me, I've seen on the social media a number of people who have posted, who are health workers, who have just been frustrated by the sheer disruption that is caused by all of those patients who come in as a result of the trauma. And so I think our people need to understand, therefore, that we're trying to balance everything here properly. Alcohol is a big factor in a number of people who would have come in with motor vehicle accidents, gunshot wounds, and penetrating wound injury, which ultimately results in a lot of attention that is needed at that point. So this is the reason why we believe that during the surge, we need to actually focus on one set of problems, and that is the increasing numbers of those who are coming through. And they will be needing urgent attention, and we shouldn't find anyone coming in and only to find that the beds are blocked by people that could have really been saved from the accidents that brought them to hospital. So we have also had various comments about this issue, but all we're really saying is that we plead for understanding and for patience as we try and navigate through a very difficult time in the country. And this is one of the issues that we think at the end of the day it would be inexcusable to actually end up with beds blocked by something that's completely preventable and avoidable as the consumption of alcohol, and then end up with the lives of people with a difficult viral infection being compromised. We have also heard that some people were using some other concoctions and home-grown stuff and so on. However, that did not show us too much impact at the time we're going through the previous lockdown. So we'll monitor if there's anything else that's coming through causing us a problem.